So today we are going to see about ECG. So we all know what ECG is. ECG is the graphical representation of the electrical activity of the heart. And so before knowing what ECG is, we should know the electrical conductivity, the activity of conduction of electrical impulses by heart, especially the myocardium of the heart. So we should know at least the outline of how the conduction of heart goes place. So in order to know how the electrical impulses are conducted, we need to know something about the pacemaker cells. So our myocardium has 4 pacemaker cells. The first one is sinoatrial node. The sinoatrial node has automaticity, which means it has the capacity to generate own electrical impulses, and these electrical impulses are conducted towards the atrioventricular node, which further conducts it to the bundle of His, and through the bundle of His it goes to the Purkinje fibers. From the Purkinje fibers it provides the impulses throughout the ventricles. So this is how the conduction of electrical impulses goes through in the heart. So this is what is represented as a graph in the ECG in this format. So this is how a normal ECG looks like, and a normal ECG has P wave, a depolarized wave, QRS segment followed by the T wave. We'll come back to it in a short time. Now, so how is ECG done? So generally there are several LEDs placed on the surface of human body to record the electrical activity. So there are 12 LEDs, to be accurate. There are 12 LEDs, and there are 2 types of LEDs. The first type is bipolar LEDs. These LEDs are divided as bipolar LEDs, and the bipolar LEDs are also called as standard limb LEDs. And these limb LEDs are placed only on the limbs of the human body. So for example, we have 3 LEDs which denotes the bipolar LEDs: limb LED 1, limb LED 2 and limb LED 3. Here is the limb LED 1, which is placed from right arm to the left arm, and we have limb LED 2 over here, which is placed from right arm to left foot, and limb LED 3, which is placed from left arm to left foot. And when you look at this direction, we get an equilateral triangle. So this denotes the heart is in the center of this equilateral triangle, and this is also called as the Einthoven triangle. And he was the one who discovered ECG, and he is also called as the father of electrocardiogram. And now the second type of the LEDs are unipolar LEDs. The unipolar LEDs has several LEDs. For example, unipolar LEDs have LEDs called AVR, AVL and AVF. These 3 LEDs, which belongs to unipolar LEDs, are also placed on the limbs. They are also placed right around the right arm, left foot and left arm, but these are all unipolar LEDs. And unipolar LEDs also have several LEDs which are named from V1 to V6. So these LEDs are placed only on the surface of chest of human body, and I will show you some pictures. So this is how the V electrodes, V unipolar electrodes, are placed on the surface of human body, and we have V1 to V6. V1 and V2 are generally placed on the 4th intercostal spaces, and we have V3 which is placed between V2 and V4, and we have V4 right in the fifth intercostal space. Over here is V4 which is placed on the fifth intercostal place and around the mid clavicular line, and next we have V5 also placed on the fifth intercostal space on the anterior axillary line, and V6 which is placed exactly on the axillary line. So all these leads are placed on the chest. And now we will focus on the ECG. So generally the graph of the ECG, we have along the x-axis time is denoted, and along the y-axis we have the amplitude in millivolt. The time is taken in seconds, and along the x-axis for 1 mm, for one single box along the x-axis we have 0.04 seconds. So one small tiny box refers to 0.04 seconds. So for 5 boxes it concludes 0.2 seconds. For example, from 0 to 0.2 it shows 0.2 seconds, that is 0.20 seconds to be accurate. So one tiny box shows 0.04 seconds, so total of 5 shows 0.20 seconds. And on the y-axis we have amplitude, and the one tiny box in the amplitude shows 0.1 millivolt. So 5 boxes shows 0.5 millivolt, so 0 to 0.5 millivolt. So this is how the graph is prepared for ECG. And now we should know the general names of all these waves which are produced during one cardiac cycle, that is from 0 to 0.8 seconds. So the initial depolarized wave is called P wave, which is followed by QRS wave, and which tends to end in the T wave, and then there is isoelectric baseline where there is generally no electrical activity conducted in the heart. So now we are going to analyze the ECG. So this is how we get ECG. So what does this sheet really tells to us? So we need to, in order to know what this sheet tells to us, we need to know the individual characteristics of all these waves, so that we could determine what is wrong and whether it is normal or we have some kind of abnormalities regarding the electrical activity of the heart. So in order to know this, first we will see after the P wave, what are the general characteristics of P wave and what does this wave generally tells us. So analysis of ECG. So in order to know the analysis, we need to know about P wave first. So what does this wave mean? The P wave is generally the depolarization, denotes depolarization. That is the spreading of impulses from the SA node. So this denotes the spreading of impulses from the SA node, and so we should know the normal time for this P wave is around 0.1 second, and the normal amplitude for this wave is 0.1 to 0.12 millivolt. So now we'll come to know about the clinical significance of this wave. So there are several kinds of diagnosis we can make using this wave P. So if the P wave tends to look taller, for example, this is the normal P wave. If the P wave tends to look a little taller, then we can make a diagnosis that the patient may suffer from right atrial hypertrophy or left atrial hypertrophy if it has a broad base. So if it is generally tall, we can suggest that the patient has a right atrial hypertrophy. If it has a broad base, we can suggest that he or she might have a left atrial hypertrophy. Along with this, if we have a small or shapeless P wave, we have atrial extrasystole. So write it down. So if P wave is generally tall, if P wave is tall, we might have right atrial hypertrophy, and if P wave has a broad base, we might suggest the patient has left atrial hypertrophy. And if the P wave is small, if the P wave looks small, then the patient might suffer from atrial extrasystole. And if the P wave is absent, so write absent here, if the P wave is absent, the patient might suffer from hyperkalemia. So hyperkalemia means excessive amount of potassium found in the blood along with atrial fibrillation. And if the P wave looks inverted, we might say that the patient has a fast heart rate, that is tachycardia. So the P wave has the potential to show so many diagnoses. And next we are going to focus on the QRS complex.